Le donneur de sang, quand il arrive à l'hôpital Laquintinie de Douala, doit être muni déjà d'une pièce d'identification. La première étape pour le donneur de sang, c'est l'identification. Ensuite, il y a une étape de remplissage d'une fiche. Après cette étape de remplissage d'une fiche, il y a une étape de sélection médicale. Après la sélection médicale, lorsque le donneur est éligible, il y a une étape de prélèvement. Après l'étape de prélèvement, il doit se reposer environ 10 minutes. Et puis, une fois que le don est terminé, il peut repartir. Alors, avant de repartir, on lui donne un rendez-vous. Alors, ce rendez-vous sera pour un prochain don et également pour récupérer ses résultats d'examen.
When the donor comes, the first thing he does is that we check him in our electronic platform, the EPN4. We check to see when was the last time he was in the blood bank, when was the last time he donated. And also, if he donated the last time, what were his results? If after checking you had never donated, you are given the selection form that you have to fill. Now, if you had already donated, we'll check whether you had donated more than 3 months ago. If you meet up with that criteria, you receive another form. If you had given less than 3 months, you are rejected. So once you pass the first checkpoint, you receive the form, you fill the form. Now when you fill the form, you go to the selection room where they take your weight, your blood pressure, and your hemoglobin value. Now it is after that point that you know whether you are eligible or not. When you are eligible, they send your forms for registration. They register you, they give you a unique identification code. That identification code is going to be on your form, your medical selection form, in the register, and the blood bag and the tube that we are going to collect you in. So when the registration is done, you are called up for collection. Your sample collection, where they're going to prick you with the bag, and you're going to fill up the bag. It takes between 10 to 15 minutes, depending on the individual and depending on the level of physical education. That's people are usually active sports-wise. And once we are done with the collection, after the needle is removed and the blood bag is taken away, you have to be for observation on your chair for 10 minutes. Now the 10 minutes is a period for us to observe you to ensure that there are no incidents after donation.
Pour obtenir une poche de sang à l'hôpital Laquintinie, il faut déjà être muni d'une demande de sang. Cette demande de sang doit être accompagnée de l'échantillon du patient. Une fois que l'échantillon et la demande arrivent au niveau de l'hôpital Laquintinie, le demandeur se présente au poste de sortie des poches de sang et toutes les étapes seront ensuite lui seront communiquées. On va attendre la vérification du groupe sanguin, les tests de compatibilité, ensuite la délivrance de la poche de sang dans un conteneur approprié.
Here at the blood bank of the Laquintine Hospital, to have a pint of blood, be it 250 milliliters or 500 milliliters, it is the same cost. So you need for every pint of blood 2 donneuses and 21,500. And when you're coming to the blood bank to have the blood, you're supposed to come with a blood request form signed by a medical doctor with the stamp of the medical institution he's working with on the blood request form. And also you're supposed to come with the patient's sample in an EDTA tube, a purple tube as it is commonly called. Everybody between the age of 18 to 60 are eligible for donation, whether male or female. Now, the criteria will differ between the males and the female in that there are some physiological factors in the female that may influence her period of donation. If, for example, a woman is on her period, if she's pregnant or breastfeeding, then she is not eligible for donation. But apart from that, Every donor has to have a weight above 50 kilograms, should have a hemoglobin value for women above 12 and for men above 13 grams per deciliters, and your blood pressure is above 15 on, it's below 15 on 10, then you are eligible for donation if every other question on the questionnaire is okay. So some of the reasons for which we reject donors: if you have taken alcohol before donating, before coming for donation, 24 hours before, you're going to be rejected. If you have smoked before coming for donation, you're going to be rejected. If you have donated blood less than 3 months before the actual date you're coming again, you're going to be rejected. If we look at your medical history, or we look at your person, for example, and we see that we deem it fit that you are not truthful in your responses to the medical questionnaire, because we have challenges with people that do not respect the date, the personnel has the right to refuse that you donate. Another thing is that we look at your can call it your physical appearance. Some people have difficult veins. If your veins are too difficult to collect, for example, and we see that we may not have the possibility of pricking you properly, you may be eliminated based on that criteria.
Alors, essentiellement, l'hôpital Laquintinie rencontre un gros problème en termes de donneurs volontaires. Nous sommes et nous restons toujours en dessous des 1% de dons volontaires à l'hôpital Laquintinie, et nous espérons que nous aurons plus que 1%, qui sait 100% de donneurs volontaires.
Actually, blood donation is a free will act. It is a person that judges that he can give of his or her blood to another one who needs it. So here in the Laquintinie Hospital, we do not have remunerated donors, if I should say. Remunerated donors are donors that the hospital pays so that they can give blood. We at the Laquintinie Hospital, we do not pay our donors. The donors that we have benevolent donors. These are people that just come and donate blood on a regular basis every 3 months for no reason other than the fact that they want to donate blood. It doesn't matter the patient who is going to receive it. So they're not giving for a patient in particular, but for everybody, let's say so. Then you have family replacement donors. Family replacement donors are donors that are given because their family member needs blood, or their family member took blood and now they have to replace it in order to clear off their debts in the hospital. And these ones, because they are coming from the family, the hospital does not pay them. If there's any payment that has to be done, it is between the family and the donors.